Mycetome, a chronic specific granulomatous destructive disease involving the skin and subcutaneous tissue, may be caused by fungi or bacteria. Buerger's disease involves small to medium arteries. It is common in smokers. It commonly involves lower limb vessels. The most difficult area to visualize using duplex scanning B-mode ultrasound, especially in an obese patient, is aortoiliac segment. Which of the following vital structures in the axilla should always be preserved in modified radical mastectomy? Axillary vein, nerve to serratus anterior, nerve to latissimus dorsi. Most common metabolic abnormality associated with gastric outlet obstruction, hypochloremic alkalosis. The gold standard for diagnosis of GORD, gastroesophageal reflux disease, is 24-hour pH recording. Which of the following factors predispose to the development of incisional hernia, malnutrition, postoperative wound infection, immunocompromised patient? Which of the following statements regarding papillary thyroid cancer are correct? It is the most common malignant tumor of thyroid gland. It is more common in young females. Distant metastases are uncommon. Statement correct about peptic ulcer is anteriorly located duodenal ulcers are more prone for perforation. Statements correct regarding annular pancreas are a ring of pancreatic tissue surrounds the second or third part of duodenum. It presents with vomiting due to duodenal obstruction. Duodenostomy is the preferred treatment of annular pancreas. Which of the following scoring system are used for assessing the severity of acute pancreatitis? Ranson and Glasgow score, Apache score, modified Marshall score. Which of the following statements regarding a patient of liver trauma are correct? Surgical exploration, laparotomy is required in hemodynamically unstable patient and patient with free intraperitoneal fluid on fast. Contrast enhanced CT abdomen should be done in hemodynamically stable patient. Blunt injuries have a higher mortality as compared to penetrating injuries. The least marked function of a human spleen is reservoir function. Which of the following are cause of retroperitoneal fibrosis, lymphoma, drugs, carcinoid tumors? The most common brain tumor in an adult is cerebral metastasis. Which of the following are included in triad of presentation of brain tumors? Raised ICP, seizures, focal deficit. Triaging is done to prioritize the treatment in case of trauma. The patients are color coded. The yellow color code signifies urgent. 6-year-old boy has recurrent history of pain and swelling below his left ear, which generally lasts for 3 to 7 days and improves mildly after a course of antibiotics. Xylography shows punctate sylectasis. He should be treated by endoscopic washouts and antibiotics. Hypotension in an unconscious head injury patient is most commonly due to associated injuries of abdomen or chest. Preoperative investigations done prior to surgery depend upon which of the following: type of surgery, patient origin, patient comorbidities. Which of the following are included in grade 2 acute cholecystitis? As per Tokyo Consensus Guidelines for severity, elevated white cell count greater than 18,000 mm3, duration greater than 72 hours, marked local inflammation. The maximum tensile strength that a wound can reach after healing is complete in comparison to normal skin is 60 to 80%. The most common site for development of a pressure sore in debilitated patients is ischium. Which of the following are included in triple assessment in case of breast? Clinical, radiological, histopathological assessment. Which of the following are extraintestinal manifestation of Crohn's disease related to disease activity? Amyloidosis, pyoderma gangrenosum, erythropathy. Which one of the following is correct regarding gastrointestinal stromal tumor GIST? 50% rise from stomach. Treatment of achalasia. Botulinum toxin, pneumatic dilation, Haller's myotomy. Which of the following are intraoperative features of viable small bowel? Visible peristalsis, shiny appearance of small bowel wall, visible pulsation in the mesenteric artery. Which of the following statements regarding peptic ulcers are correct? Duodenal ulcers are more common as compared to gastric ulcers. Helicobacter pylori and NSAIDs are most common causative agents. Bleeding is the most common complication associated with posterior duodenal ulcer. Which of the following statements are correct with regards to Budd-Chiari syndrome? Venous drainage of liver is occluded by hepatic vein thrombosis. It is associated with protein C, protein S and antithrombin III deficiency. Abdominal discomfort and ascites are the most common features associated with acute thrombosis. Which of the following are included in Ranson scoring system to predict the severity of acute pancreatitis at the time of admission? Blood glucose greater than 200 mg per deciliter, LDH greater than 350 units per liter, EST greater than 250 units per liter. Cystic fibrosis involves which of the following organs? Lungs, liver, pancreas. The commonest variety of peritoneal metastasis, discrete nodules. When the hernia extends between the layers of abdominal wall muscles and not directly through them, it is called Spigelian hernia. Which of the following are tension-free inguinal hernia repairs? Stoppard's repair, Lichtenstein repair, laparoscopic TEP repair. Which of the following are correct with regard to lung cancer? Surgical resection has a limited role in curative treatment of lung cancer. Pattern of disease and prognosis of Hort cell carcinoma are different to other varieties in the lung. Small cell lung cancer is a type of neuroendocrine tumor, NET. Squamous cancer appears as a cavitating tumor in the lungs. Which of the following are true about epidermal cyst? It is lined up, stratified squamous epithelium. It is derived from hair follicle. It is also called sebaceous cyst. Which of the following are correct about glomus tumor? It arises from Sake-Hoyo canal. Its usual site is nail bed. It is usually a small purple nodule. Which of the following are correct about Felty's syndrome? It is associated with rheumatoid arthritis. It may present with leukopenia. It may have splenomegaly. Anderson-Heinz plasty is a type of repair of renal pelvis.